Okay, now we're going to talk about fall risk and prevention in people with dementia. As fall is defined as a problem with standing, sitting, or laying, which results in persons sudden unintentional relocation either to be the ground or onto contact with another object below or the person's starting point. Falls are the leading cause for fatal and non-fatal injuries to people over the age of 65. More than 11 million people over 65 fall each year. Among adults 70 years and older, 7% of the hospitalizations are from fall-related injuries. Falls cause over 90% of broken hips. Over 9% of people who've had a hip fracture were unable to walk again. Falls are the leading cause for traumatic brain injury. Over 13,000 people will die from fall injuries this year. 30% of people suffering hip fractures die within 1 year. Raya's Paradise Belief. Raya's Paradise believes that each person has the right to walk and be independent as possible, even if the risk for falling is great. This is called dignity of risk. Raya's Paradise does not allow any restraints to be used. Restraints include any method that prevents a person from getting up, in or out of their seating or lying. Examples of restraints include medication that drug a person, jerry chairs, bean bags, Broda chairs, sheets, ties, ropes that prevent a person from moving or getting up, side rails. Again, at Raya's Paradise, it's our belief to allow our resident the dignity of risk. This means we don't get a chair, block the resident from being able to get up. That is considered a restraint. We also don't use sheets, the bed sheets, or any form of way to restrain the resident. We allow them to be free. This will prevent behaviors from occurring, and again, it's the dignity of risk. Risk factors for falls. A previous fall is the greatest risk factor for any other fall. Ambulation difficulty, it could be the age, environmental hazards, being an older female, medical conditions, medications, vision problems, acute illness, fear of falling, fluid imbalance, dehydration, unsafe footwear, other factors such as the day or time, or fatigued. Number 1, previous fall. This is the biggest predictor for having another fall. People who have had one fall will generally fall again in 6 months or less. Problems with walking. Anyone who has unsteady gait, uneven steps, shuffling, balance problems, leaning to one side or leaning forward may be at risk for falls. If the person takes more than 30 seconds to walk 20 feet, fall risk is generally increased. Keep in mind that when you have a new resident moving into the community, the chances of them falling is very high. Usually falls occur within the first 48 hours of admission. Why is that? We're not fully aware of the resident's ability to ambulate. We don't know if they have the right fitting shoes. So always keep in mind that when you get a new resident, they are at high risk for falls. So you need to be very careful and make sure that you are looking out for any reasons why the resident might be at risk for falling. Age is another factor. Having less feeling in the legs and feet, especially diabetics. Slower reflexes and reaction time. Generally have multiple medical conditions. They're more frail and often taking several medications. All of these factors make the person more at risk for falls. Again, making sure that you are aware if a resident is with us and they are taking different kinds of medications, they might be at risk for falls due to the medication. If somebody is diabetic and maybe their legs are swollen, they might be at risk for falls as well. Environmental hazards. These are the leading cause of falls, accounting for 25 to 40% of most studies. Many of these hazards are easily fixed and falls are preventable. Environmental hazards include spills, tripping over wires, electrical cords, or objects left in the hallways. or uneven broken sidewalks. Again, environmental hazards are a big risk. So, looking in the surrounding areas, making sure that your resident is not in an area where there's maybe a laundry cart or a housekeeping cart or a trash can that might cause them to not be able to see it and fall. Sometimes, when doing activities, we put out activity equipment and not remembering that the resident might be walking in that area and they might trip and fall. All of these are tripping hazards. If you see a spill and the resident is in that area, please make sure that you call somebody in housekeeping and or you attempt to pick up the spill yourself. This will avoid the resident from tripping and falling and getting injured. Number 5, being a female, females have a higher risk for falls. Women have smaller bones density than men and suffer from osteoarthritis and osteoporosis more frequently than men do. Caucasian and Asian women are the greatest risk. Women incur 80% of hip fractures. 6, medical problems and acute illness. Infections such as a urinary tract infection, pneumonia, upper respiratory infection, or the flu all increase fall risk. Dizziness and fainting. TIAs, which are called mini strokes, and irregular heartbeats all lead to the increased fall risk. Dehydration is a major cause of falls. Orthostatic hypotension, which is considered low blood pressure when standing up, causes falls when the person changes from lying down to standing suddenly. Again, let me explain a little bit more about some of these things. Medical problems. If a resident is ill and they have an infection and or they have pneumonia, or you know that they just came back from the hospital, they're going to be at a higher risk for fall because they are very weak. Lower extremities are weak, they're under physical therapy. So please keep in mind that all of these things are at risk for falls. Again, being a female and or medical condition, anything that is obstructing the hallways, the not proper fitting shoes, all of those things, you need to be vigilant and making sure that you are observing and reporting to your nursing department if you see any changes. A urinary tract infection is very common in elderly people. Therefore, this can cause they're at high risk for falls. Urinary tract infections can be detected in either changes in mood, behaviors, and or a foul-smelling urine. So please keep all this in mind when you are looking at a risk for fall. And remember, all new residents that move in are at high risk for falls. Okay, let's talk about medications. The use of 4 or more medication increases fall risk greatly. Some of the drugs that cause an increased fall risk include all psychotropic medications, drugs, most heart medications, all medications for seizure prevention, allergy drugs for colds and sinus congestion, all sleep medications, all antidepressants, and all narcotics for pain control. So let's review this list again. Anything that is a psychotropic medication. So maybe this is a medication that a resident takes at nighttime for sleep. Most heart medications. Anything that is for seizures. Anything that is for colds, the common colds or allergies, antidepressants, and any narcotics. Maybe somebody took something for pain. Again, all of these medications can increase the risk for falls. Let's talk about vision problems. Many older people have eye conditions that increase the risk of falls. Cataracts, glaucoma, macular degeneration all increase the risk for falls. Many people with dementia are no longer able to wear their glasses. Depth perception is also missing with dementia. So again, vision problems are a high risk. The resident doesn't understand or know that they have to wear their glasses, therefore they can't see correctly, which poses a higher risk for falls. Unsafe footwear. We covered this a little bit, but many falls occur because the person is wearing shoes that do not provide the right foot support. The shoes may be the wrong size, they'll slip off, or may become slippery if wet, causing a fall. People with dementia often wear their shoes on the wrong feet. So it's important when you're dressing your resident in the morning to make sure that you help them put their shoes on correctly, that they fit properly, that they're not loose fitting, and that they're not slippery. We don't have any carpets within the community. However, again, if something is wet or they can't look down and see what's in front of them, this will cause them to fall. Some of the fall preventions. So 1, exercise. One of the best defenses against fall is exercise. The benefits of exercises include increasing the blood flow to all the organs, maintaining muscle strength and coordination. Decreasing blood pressure prevents the need for medication to decrease a high blood pressure. Increase joint flexibility, increases endurance. All of this are the benefit of exercising. Medication reduction. Any 1 or 4 or more medications is at risk for falls. This includes over-the-counter as well as prescription medications. At Raya's Paradise, we always make sure that the nurses are monitoring and making sure that we can reduce any medications. Anything that we can take away to reduce the risk of falls, we will do. Removing hazards. We've talked about this. Looking at and wiping up any spills immediately, providing good lighting indoor and outdoor, the use of assistive devices. Be certain that the person has his or her walker or cane in front. Now, let's talk about assistive devices. In dementia residents, they don't like to use assistive devices. They don't like to use their walker, and in most cases, they don't want to use cane. They may not have the ability to use the cane, and they most certainly don't want to use a wheelchair. Very important that you know that if they have unsteady gait and they're unable to walk on their own, that you help them and make them understand why using a walker is beneficial to them and or sitting in their wheelchair. Hip protectors. What are hip protectors? Hip protectors is a brief that is put on and it's padded on the sides. These are used to help prevent any hip fractures. So therefore, if you have a resident who is at high risk for falls and you know they're unsteady, and because we don't use any restraints, please notify nursing so they can get them a set of hip protectors. In the event that the resident falls using a hip protector, this will immediately protect their hips, then causing them not to potentially have a hip fracture. Hip fractures are very dangerous. If a resident has a hip fracture, they have to go out to the hospital. Then they have to have surgery. The chances of them returning can be very slim. That also increase confusion. Most residents with dementia cannot sustain a surgery, so wearing hip protectors can be important. Please keep in mind that your eyes, your ears is the most important for our residents. Therefore, if you see that a resident is a high risk for falls and would benefit from hip protectors, please let nursing know. We talked about proper fitting shoes. We also have talked about vision. Be certain the person is wearing his or her glasses if it's appropriate. Again, most residents with dementia may not want to wear them. Avoid sudden changes in light. If the person goes from light to dark, outside to inside, their vision is going to adjust. Have the person stop and give them time for their eyes to adjust before continuing to move. Leave a night light on if the person gets up during the night. Encourage an annual eye exam for ambulatory people when possible. Again, as a caregiver or anybody taking care of residents with dementia, the vision is also very important to prevent any falls. So keeping in mind they don't like to wear their glasses, helping them understand why they're needed is beneficial, but for the most part, they're not going to want to wear their glasses. We will take a break.